Let's talk about probiotics and magnesium. If your loved one has issues with bowel movements or irregular bowel movements and other things and are on probiotics and or magnesium, we need to talk about this. I'm Bienstock. I'm a board certified plastic and reconstructive surgeon. I specialize in wound care, particularly in the elderly and those that are homebound and bedbound. So it's not uncommon, most of my patients who are over 80 and sometimes 90, they're homebound and bedbound, they're getting probiotics. The issue is a lot of them are receiving probiotics with food. Probiotics do not work. I want to repeat this, it's very important. Probiotics do not work with food in your system. It's recommended to take probiotics first thing in the morning, at least 30 to 45 minutes before you consume the first meal, and at nighttime right before you go to bed. If there's any food in your system, most likely it'll wash away the effects of probiotics. Before we start getting into more detailed things, let's talk about what probiotics do. They maintain the normal the normal bacteria in your gut. What that means is you have good bacteria and bad bacteria. We want to maintain the good bacteria. When you're on antibiotics, a lot of times it kills the good bacteria and it makes you have irritable bowel as well as having diarrhea, which can lead to something called Clostridium difficile, which is a bacteria that can make you have diarrhea and cause a major infection. We want to prevent that. All of my patients who are on antibiotics, I definitely recommend giving probiotics. Now, a lot of you are asking me, or right now you're thinking, what about yogurt? Some yogurts has acidophilus, which is very effective, but it does not have a high enough concentration to really have a medicinal effect. So you have to make sure your yogurt, which is not besmirched with a lot of sugars and other unnatural products, has a high enough acidophilus content. I much prefer probiotics. It's easier to take. I have my children on it, and I have my mom and myself are on it. I take it twice a day. You want to look for high doses. If you're not able to swallow pills, there are liquid forms. They're gummy forms. You just want to make sure they're not filled with a lot of preservatives, sugar, and other, we'll say, unpleasant chemicals. In terms of magnesium, there's another thing that I recommend. It's not uncommon for people to have irregular bowel movements. Either they're constipated or have very loose bowel movements, and it's irregular. It's very common when you're older for your GI system to be a little out of wonk or a little out of sync. Probiotics does help. Magnesium definitely helps with constipation. A lot of my elderly patients are on magnesium. This helps with muscle activity. Your intestines and your gut are made of muscle, so you want to make sure that it has optimum contractile capacity, meaning it's able to squeeze. So magnesium definitely does help. It's very hard to OD on magnesium unless you're really on a super high dose. I would discuss this with your primary care physician. I do have recommendations which I can discuss with you below. I really do recommend both magnesium and probiotics. Make sure that probiotics is given an empty stomach. Something that's not feasible if you're on a feeding tube, which means that you're getting continuous feeds. I recommend those patients just take an hour break at the feeding tubes and put probiotics. And a lot of medications can't even be consumed with continuous feeds. So this is something you can do both in the morning and nighttime. If you're able to eat regular foods or you're having softer pureed foods, just make sure you're not having this anytime close to having the probiotics. I look forward to your comments below. Please let me know if you have any advice or suggestions. And thank you very much. Make sure you subscribe to the channel when you get a chance. Thank you.